The intervertebral discs are an avascular structure, and without a blood supply, they rely on osmotic diffusion for nutritional transfer of primarily glucose, oxygen, and water. As the discs are loaded throughout a day of activity, up to 20% of the disc fluid is pressed out of the discs. During the typical 8 hours of daily rest, when a person lies supine, the pressure within the discs is approximately 75 millimeters of mercury, while the pressures surrounding the disc are approximately 80 millimeters of mercury, creating a diffusion gradient of approximately 5 millimeters of mercury. This small diffusion gradient of 5 millimeters of mercury promotes the influx of fluid, glucose, oxygen, and water back into the disc. As this is an inefficient mechanism, intervertebral discs will gradually degenerate over a person's lifetime. In addition, as the intervertebral discs are constantly under a positive pressure, annular fissures, tears in the annulus very seldom fully heal. Intervertebral discs are incredibly resilient to loading, where if they are loaded under a perfectly symmetrical circumferential load, the vertebrae will crush before the disc will be damaged or compromised. The most common causes of disc injuries are through non-symmetrical loading and twisting of the spine. Lateral bending of the spine under load causes distortion to the disc annulus through non-symmetrical loading, with compression of one side of the annulus and stretching of the opposite side of the annulus. When rotation of the spine is added to lateral bending of the spine, this torsion to the annulus will cause shearing and subsequently fissures in the annulus, allowing the disc to bulge, herniate, and perhaps prolapse. All therapies to treat disc pathology with lateral applications of force and rotation of the spine should be avoided, as these maneuvers may exacerbate disc pathology and annular fissures. Some of the most common disc pathologies are disc bulge, disc herniation, disc prolapse, and disc degeneration. In general, disc bulges, herniations, and prolapse may be due to varying degrees of tears in the annulus of the disc, allowing the nucleus to press on and extend the outer wall of the disc, and in some cases, extrude outside the disc. Disc degeneration affects the majority of the population and typically increases with age due to the body's limited ability to restore hydration and nutrition back into the disc. SpineMED's patented technology is not found on any other device and provides a superior level of treatment outcomes and clinical efficiencies in the treatment of lumbar and cervical disc pathologies. SpineMED has been shown to be incredibly effective in the treatment of disc bulge, disc herniation, disc prolapse, and degenerative disc disease. Older technologies that employ conventional traction harnesses to capture the patient and apply distraction forces are inefficient in that they apply the force throughout the entire torso. The nylon pelvic harness must capture the entire lower trunk and act as a clamp to secure the torso and subsequently deliver force to the underlying skeletal structure. This force must be transmitted through a volume of adipose tissue, fat, muscle, and organs prior to ultimately applying distraction forces to the lumbar spine. As these harness-style devices require very high force, typically 55% to 75% of patient body weight, patients typically slip through the nylon upper restraint, and so axilla bolsters beneath the armpits are required to secure the patient to the fixed section of the device. With these primary restraints below the armpits and the nylon pelvic harness, force is thus distributed throughout the entire body's torso. The application of these high forces throughout the torso and soft tissues most often will elicit an inflammatory response, which will inhibit the patient's progress and outcome. The application of force throughout the torso from armpits to buttocks can often result in exacerbation of the patient or side effects, such as aggravation of other areas of the spine. Direct capture of the skeletal structure is imperative for efficient application of distraction force to the spine. The SpineMED utilizes a unique patent-protected system for the capture of the pelvis and the application of distraction forces to the spine. The pelvic restraints in the SpineMED system do not act as a clamp to secure the pelvis, as all other systems do through harnesses or seat belts. Instead, the pelvic restraints are shaped to conform to the anterior superior iliac crest and gently rest atop the crest, rather than clamp the entire pelvis as in all other systems. As a result, this unique capture system is very comfortable for the patient and also very efficient and essentially eliminates any negative inflammatory response. As these metal restraints are directly connected to the SpineMED's high-speed electrical actuator, The delivery of energy is direct to the skeletal structure, from metal to the bone of the spine, rather than being transmitted through an elaborate system of gears, pulleys, ropes, nylon straps, and nylon harnessing, and then through the muscles, ligaments, and soft tissues of the patient's torso as in harness-style devices. This direct capture increases the efficiency of forces being applied to the spine, such that the SpineMED typically requires less than 1/5 of the force required for other decompression systems. The typical protocol for a male patient for SpineMED would be 15% of body weight when they reach their treatment plateau. With other technologies, the common protocol is 55% to 75% of patient body weight, which most often will elicit an inflammatory response. Using a 200-pound male as an example, their treatment tensions with SpineMED would commonly be a maximum of 24 to 30 pounds, while on other technologies, their maximum tensions would reach 125 pounds. This dramatic reduction in required force application during treatment virtually eliminates the side effects and exacerbations commonly experienced with other technologies. SpineMED's patented direct capture of the skeletal structure and direct application of force from the drive system eliminates the loss and inadvertent distribution of energy throughout other areas of the body. This direct application of distraction forces also allows almost instantaneous adjustments of the distraction forces being directly applied to the spine. The SpineMED creates a unique treatment algorithm for each patient, and during treatment, the SpineMED will monitor the tensions being applied to the spine in relation to the applied algorithm every 2.5 milliseconds. The device samples this measurement 8 times and will adjust every 20 milliseconds if the tensions are outside the prescribed algorithm. The SpineMED is designed to adjust faster than the human neurological response in firing the erector muscles, which is approximately 50 milliseconds. As the SpineMED directly captures the skeletal structure and the force delivery mechanism is directly connected to the pelvic restraints, adjustments to tensions are almost instantaneous. While other technologies have claimed to adjust tensions every 2 milliseconds, the use of ropes, nylon straps, and pelvic harnesses between the force generation system and the patient's spine make this claim physically impossible. SpineMED incorporates proprietary software and firmware that is unmatched and not found on any other device. The use of lower force with SpineMED improves patient suitability and tolerance to the treatment, and virtually eliminates all side effects and exacerbations commonly experienced on other technologies. Lower forces also increase the range of patient suitability, as more frail or geriatric patients are now much more suitable for decompression therapy with SpineMED. The safety of decompression therapy through SpineMED surpasses that of any other device, where tensions are so low that patients do not feel the treatment nor any distraction force. In addition to much lower force requirements, SpineMED also incorporates a unique patented pelvic tilt system to more accurately target specific spinal segments. This pelvic tilt system will place the patient's pelvis into flexion from 0 to 25 degrees. Placing the pelvis into flexion during distraction moves the focal point of the distraction forces. As the amount of pelvic flexion is increased, the further the focal point of distraction will move toward the thoracic spine. This phenomenon is limited, and the SpineMED has a maximum pelvic tilt of 25 degrees. This tilting system is also incorporated into the SpineMED cervical system, where the patient's cervical spine is placed into flexion between 0 and 30 degrees to target specific spinal segments. Other technologies employ an elevation of the traction head in the system, causing an angle of distraction between the traction head and the pelvic harness to cause a resulting flexion in the pelvis. This method of causing pelvic flexion through straps and ropes unfortunately applies force to the patient's torso in the vertical plane, where force is being used to lift the patient vertically off of the table surface, rather than applying distraction forces to the patient's spine. As the belt angle increases on these systems, so do the loss of distraction forces to the vertical plane, which simply lift the torso off of the table. Simpler traction devices without the ability to change the belt angle apply a more rudimentary distraction force to the spine, where the greatest distraction is applied to the base of the spine at L5 to S1, and then gradually diminishes up the spine. Therefore, if L4 to L5 is the level with pathology, then L5 to S1 will have to be over-treated in order to achieve significant distraction at L4 to L5. SpineMED has more than 24 years of clinical use and continues to demonstrate exceptional clinical results with a very wide range of disc pathologies and patient demographics. To summarize, SpineMED's unique and patented direct capture system is far more efficient, more comfortable, quicker to set up patients, and results in far better patient outcomes with the elimination of inflammatory responses and exacerbations due to high-force application used on harness-style devices. Conventional harness machines typically require dedicated staff to oversee and operate the device, due to the significant time of attaching harnesses to the patient and the fact that harnesses often slip off of the patient during treatment. The SpineMED is designed to integrate into a clinic without any impact on current staff, where patient setup is completed in less than 90 seconds and the treatment runs truly unattended, as it is physically impossible for the pelvic restraints to slip off of the iliac crest. Where the addition of a conventional harness-style device into a practice requires additional staff or reassignment of current staff to operate the device, SpineMED integrates into a practice without any additional staffing requirements due to its efficiency.